And welcome back again to my YouTube channel. It's your girl Chidima Olu. I'm bringing to you today something very interesting that I know you would like to hear. Now, a few years ago, before I started my pre-registration process, I searched through the internet because I really wanted to know a little bit more about the process. I wanted to just really get an insight from someone who has probably done it before and who could give me a bit more detail as to what to expect. Now, obviously, I hadn't even started the process and it wasn't my business to get to know that until I got to that time. But you know, the human in me just wanted to know more. And I do know that there's lots of people out there who also want to know something like that. Now, I've gone through pre-reg and finally OSCE, and I'm here now to stand in the gap to explain to you everything you need to know about OSCE, basically to give you an insight, even if you haven't gone through the process or haven't gotten there yet, you just want to know, what is this all about, this OSCE that everyone talks about. I would be explaining everything you need to know in this video. So if that's something you think that you might be interested in, just stay back and watch this to the end. Okay, let's go. Okay, welcome back again. Now, I'm so excited. Let's start. Okay, for those of you who don't know what OSCE is all about, it is the final exam you have to do before you fully qualify as an optometrist in the UK. I'm going to run you through, just in a very informal way, basically, about this whole thing. Now, just imagine it that you have decided to do OSCE and you've gone through all the stages, and then you've finally got to OSCE. The first thing you're going to do is you're going to book your exam. Now, when you're booking your exam, it's usually on the website, and what happens is you just get on the website and you pay. Your store most likely would pay for your exam, and then you just click on book and you put in all your details. The identification you might be needing to present would be like your passport or your like international passport or like a valid driver's license. And when you put that through, you officially become booked in for this exam. Now, if you have to receipt this OSCE, you might need to pay a certain amount, so about £680 to be able to receipt for this exam. Now, when you have booked in, the next thing that happens is on your college site, you see that you've been booked in for this exam, and then you see like the location where this exam is going to take place. Most of the time it takes place in London or in Liverpool, so either of this, but you definitely will be informed about which location. It would literally be on there on your web page there. Now, on there you're also going to see like 3 circuits on your page. You could either be circuit number 1, circuit number 2, or circuit number 3. Now, the time showing on your web page would be the time that you need to arrive to like the location of the exam. So if no matter where you are in England or in the UK and you have to do this, you have to come to London or you have to go to Liverpool if that's the location. So now you've done all of that. The next thing that goes is you need to start prepping for your OSCE. So your particular exam day, so the day that you would need to show up for the exam, will be communicated to you 2 weeks before the day 1 of the exam. So how this circuit thing works is, it's just so interesting to know that you can't cheat in an exam. So the first circuit is like the first set of people who are going to do the exam on that day. It's like it's just divided into like groups of 17. So the first 17 people will arrive at a certain time. For instance, if it's like 8:30, they just come in and then they show their passports. Like you just come line up, show your passport, and then you take away any of your phones or like your laptops, anything at all that would make you go to the internet, basically. So they take that away from you, and then they show you to a certain room. So they just allow you to have like your books, your textbooks, your revision notes, and just anything that you might need to use to revise. Then they take you to a certain room where you're going to just stay there and just like be, just keep prepping or keep like revising and things like that. That would be with all your circuit 1 group. When Seki 1 is ready to do the exam, they get taken to a different space where they all have to line up. So I'm going to get to that. So when that happens, midway into that, the Seki 2 arrives. And when they arrive, they also do the same thing and they get taken to a different room. And that way, Seki 1 and Seki 2 people, no one has any contact with each other. So they stay in a different room. Now, in the process as well, Seki 3, maybe when Seki 1 has already started the exam, Seki 3 arrives, which is like the last set. Those ones get to spend so much more time, longer time waiting, because they have to wait for all of this to finish, and then also like wait for like the lunch and things like that. So it takes a bit of a longer time with Seki 3. So they take them to different rooms. Sometimes, depending, they could all be in the same room together with Seki 2, or because they haven't written the exam anyways. But whichever way, they just keep them in a certain room and they just like obviously discuss and review. Now, once that is done, then Seki 1, once they finish, they literally like shut the door for, you know, every other one person who hasn't written the exam. Now, this is just to avoid any sort of contact or anything like that with the people who have finished the exam. So Seki 1 people just finish the exam and they just go. Like, you don't have to be around the premises, you just go away. Now, next set, Seki 2 comes and afterwards they leave, and Seki 3 finally. So no one has any way to like inform any other person about the exam, what kind of questions presents that day. Now, after that, now let's talk about the stations itself. So let's use Seki 2 for instance. Now, when you get on, so for the stations, so we have about 17 stations. When you come in, I forgot to say, they'll give you a tag and your name will be on the tag, and the station that you will be starting with will be on the tag as well. Now, so once the exam starts, you all line up according to your station numbers. So you can have like station 1, station 17, station 15, whatever the number is going to be on there. Then when you line up, as you get in there, then we have like people who organizers of the exam will all be there just to help you, to direct you like to where you need to go, where you need to stand. So it goes like different rooms, you know how you have like just imagine maybe like a hotel kind of setting where you have all the, you know, like all the doors are just literally next to each other. So everyone just goes and just stands and just backs the door basically, and the question is just on like a very small side, like it's just a paper pasted on the wall, literally very close to the door. Now you hear a voice like, can now read your question. So you have 1 minute to read your question. So you turn and face the question and you read it for 1 minute, and then they say you can now go into your rooms. Everyone just goes into the room and then they just start to like, you know, perform whatever task is given to them. Now, so for OSCE, the task that you can have, so like I said, there's 17 stations, there are about 14 major questions that you have to answer. There is one pilot station. Now the pilot station is more like a trial question. There's no mark to it. It's just they may want to see how people perform in that station and then decide to use that as a major question, maybe in a different OSCE day, OSCE year or whatever it is, but it never gets scored. So it's a pilot. Now that makes it 15. Then you have 2 rest stations for 5 minutes as well. So if you are lucky or unlucky, depending on how people view that, your station might be like the first station might be like the rest station, and you just need to go there and stay there for 5 minutes and just keep waiting. So people find it actually quite nice, or maybe not, because that's your one station, your rest station out of the way, and then you have one more rest station for the rest of the OSCE. But anyways, that's what makes it up to 17 stations. Now for the stations, let's talk about what to expect. So the questions that present in OSCE are usually from the 75 competencies that you were assessed in stage 1 and stage 2. Now they just speak questions from there. And also it's quite a bit more straightforward because it tells you what they're going to assess you on. For instance, the content of the OSCE would include things like history taking, communication, data interpretation, and clinical examination and practical skills. So for the history taking, so it's just more like you in 5 minutes taking the case history of a person and finding out what diagnosis that person, so any condition they may have come in with. For instance, they could ask you something about blurred vision, they could ask you something about reduced vision, they could ask you to take case history on diplopia, like double vision. You could take case history on like red eye, headaches, or like any sort of systemic disease with an ocular manifestation. For instance, they could ask you, like, Mr. Mark came in with red eye, take full history and symptoms on this patient and give your diagnosis to the patient or give your diagnosis to your examiner. Now it could also ask you to give take history and symptoms and give like your diagnosis and management. So just depending on what the question is, that's why you have to read it carefully. And once you go in there, you just have 5 minutes to do all of that and give your answer to either the patient or the examiner, whoever it is that you're being asked to give the answer to. Now the next one would be the communication. With communication, is more about like asking you to maybe like explain a diagnosis to a patient, or explain like a prescription to a patient, or just explain how a condition can be treated. So you could be like, explain cataract to this patient, or explain like macular degeneration to this patient, or just communicate this information to this patient. It could be like a prescription where you just have a prescription there and this patient has come into you and they have no idea what this is about basically, and then you're like, oh, this is what was given to me at the hospital, basically that. And then you have to explain like what the prescription is all about and to the patient, and also taking into consideration that the fact that this is a patient, they have no idea what any of these terms are, so you need to speak in layman terms to the patient. So that's just basically what you're going to be doing in communication, and it just could be any sort of question. So but there's always some sort of like strategy to it, how to prep for it. You could have like data interpretation, so they could give you like like a video to watch and you would explain what you've seen there, or they could give you like a visual field plot and you have to like describe this visual field plot or answer the questions, most likely maybe to the examiner or just even to the patient as well. But they always present you like an image, maybe like it could be like just any picture at all. It could be like pterygium, it could be like ocular rosacea, it could be just anything at all that obviously that you could encounter in practice, and you'll be asked to explain this data to your examiner or to the patient, whoever it is. And finally, you will be asked questions on clinical practice or clinical examination and practical skills. Now they could ask you to perform maybe like a cover test, or they could ask you to perform like ocular motility, they could ask you to do like retinoscopy, they could ask you to do like a Vogue, or to do like a slit lamp technique. Just any of this is just more about like all of the practical skills that we usually use on a daily basis at work. You will be asked to perform this on like a patient. So that's just basically what clinical examination is going to be about. So for all of these things, I'm not saying this for you to be worried if you have not gotten to the stage yet. Just always a way to prep for it. So once you get to that point, you're definitely going to be able to get through. Okay, so basically now once you're done with any station or with like your station, you just move straight to the next station. You read the questions on the wall, you get in and you just perform your history or whatever questions that you've been asked. You come out of there, you move to the next one. Sometimes it's so messy, but there's always people there to direct you like on where the next station to go. Like I just talking about this right now, I literally just remember myself like running through every station like door to door. It was just so funny. I mean, like it's funny like speaking about it right now, but like doing it at the time, it's just like in my head I'm like, nothing else matters right now. I need to see what question, what station is this, that kind of thing. So it's just so it's just, I mean, thinking back is really a funny experience. But to think that you have to prep so much, like, you know, like months, or, you know, however long you need to start prepping for, just for like few hours. Like the OSCE just starts like this and finishes like this. Like before you know it, you're done. It's just such a quick exam, you know, and it's just amazing how like you just have 5 minutes to finish that. We always say, do not overthink any station that you may not have performed well in, just like go straight to the next one. But honestly, it's still hard because you get like still nervous, and it's just, honestly, I can't even say that much. Anyways, so you're done with the OSCE. The next thing would be to wait for the result. On the website, you always know what day your result will come out. So that's just always the scariest of them all. And it's even more annoying that you have to just wait for so long. If, for instance, you started OSCE like the first week, you probably have to wait like 3 weeks for the whole exam for the result to get released. It's just such a long time to just like stay so nervous and like waiting for the result to come out. But I mean, it is what it is. You can't do that much in it. Once the result comes out, if you fail, which is always the very hard bit, that you have to work so hard and then it just doesn't come out well, like honestly, don't beat yourself up, because it's just such a quick exam. Anything could happen. You could be so nervous that you're not able to, like, you can make really silly mistakes. It's just something, it's just inevitable with OSCE. But honestly, if you fail, it's just one of the things that could happen, to be fair. But if that ever happens, don't worry, it's not the end of the world. You can always retake the exam again. It's just you have to pay, but it's okay, it's fine. At the end of the day, it's just worth it. Once you pay and you pass, at the end of the day, you're going to be really happy, and you will not even think about like all the stress you've been through for that. It's just one of the experiences. The world will not end without failure. Trust me, like, you're going to be okay. And then if you pass, yay, congratulations. That would be amazing. The next thing would be registering, like with the GSC, to get your GSC number, and also registering to become a member of the college as well. It's quite an interesting process, I must say. However, it's okay. Like, whatever the outcome is, you'll be fine. Trust me, you definitely will be fine. I hope that I've been able to do justice to explaining this whole OSCE and what it all, you know, represents, and everything that you need to expect. So if you have any questions about this OSCE or anything else about pre-reg, please do ask me, okay? And I'll be more than happy to respond. And until next time, enjoy your time, and I wish you all the best.